and it is important to note today marks the World Elder Abuse Awareness Month, or Day, at a time where the physical and mental abuse on the elderly is also rising in the face of the pandemic. Now, to our conversation of the day, remember we are talking about the disruption that COVID-19 has brought to us as a society, and today we take stock on how it has actually eaten away on the gains of gender parity and inclusion. And to help us have this conversation, in studio with me is Wangeshi Wachira. She's Executive Director, Center for Rights Education and Awareness. Thank you for joining us. We also have Rachel Mwikali, who is the women rights activist, and lives in Mathare. So she brings in a very crucial scope from the informal settlements. Then we also joined virtually by Catherine Musakali, who is a co-founder Women on Boards. Thank you for joining us. And we're also having Charles Leshore join us virtually. He is a project manager, Amref Health Africa, and he brings also a very vital outlook on how it looks like in the marginalized areas. And Alberta Wambua, who is executive director at the Gender Violence Recovery Center. Thank you so much for joining us, everybody. And I'll start off with you, Wangeshi. I think we need to clarify, what is gender equality, and does it necessarily mean safeguarding only the rights of women?
Thank you, Gladys. I think rightfully this is a term that is used to be able to define a position where both men, women, boys and girls are able to enjoy equal rights. As, for example, in our country, they're enshrined in our Constitution 2010. It also means that both women and girls, men, are able to access opportunities, and they're able to enjoy freedoms that come with that. So this is not just about women. But why there is a focus on women and girls is because we recognize that even if our desire is for both genders to be able to be at par, there is a gender that had been left behind for very many years. And therefore, then to be able to bring them to par is that there are certain things that must be put in place, whether they are programs, whether they are policies, whether they are laws, so that then both men and women, boys and girls, can be at that level where they can be able to enjoy equal rights. And it looks at issues of justice. It looks at issues of women human rights. It looks at issues of how our resources are allocated, who is allocating them, who is making decisions. Are they both men and women?
Yes.
Are they being represented there? Are there cultural issues that inhibit them, or are there barriers right there that inhibit them to be able to realize those? So it's a journey, and we are not yet there. And I doubt if in the whole world whether there is a country that has reached that. There are countries that have made milestone, but not yet there. Yeah.
Okay, so just to reaffirm what Catherine is saying, or rather, Wangeshi, with women being 50% of the world's population, they then deserve equal access to health, education, economic participation, and political decision-making power. Now, they say women hold only 7% of the world's government leadership roles, but several women leaders are actually drawing praise for their skillful navigation of the coronavirus pandemic. Now, some of those that have stood out are German Chancellor, that is Angela Merkel, and New Zealand PM Jacinda Ardern, and right across the border, we have the Ugandan Health Minister Jane Ruth Aceng, and right here in our country, Dr. Mercy Mwangangi, who is the CES for Health, has actually stood out in the face of this pandemic. Wangeshi, when you see these women stand out at a time where the world is literally having a fire under their feet and excelling, what does it mean to you?
I think for me that goes to reaffirm that it's possible for women to occupy those decision-making positions, and for them to make decisions with a lot of humility, to make decisions looking at what is affecting the people, making decisions that are quick, fast. I think when you look at, for example, Finland, we have a prime minister who was elected by the parties, who is the youngest prime minister at the age of 34, with the pandemic, within a very short time, she was able to close to ensure that curfews had been put in place. She also looked at how does the country, Helsinki, for example, the main town, how do they close the borders? How do they ensure that people can be able to respond within the shortest time? And you can be able to see the data from that country showing that are compared to a country, for example, like Sweden, the death rate in Finland is so minimum compared. I think the death rate at about 140 compared to 10 times to Sweden. When you look at a country like Taiwan, again with a president who is female, within a very short time, from January when she realized the pandemic is here, within a very, very short time, then she was able to reorganize the whole country, ensure that people will be able to access water, people could be able to wash their hands. And more to that he also ensured that, for example, there were PPEs and face masks being made within the country and being even distributed to other parts within Europe, within the US. Again, in New Zealand, the Prime Minister, within a very short time, she was able to realize that we must be able to respond to the pandemic and be bold in the decisions that we make. I think it's the only country that had, in terms of the numbers of death, very, very minimum. So when we see Angela Merkel calling for this solidarity in response, so when you see women leaders occupying such positions, it goes to reaffirm that the decisions that they're making, they're dignified, they're able to look at with them with a lot of humility. They're also able to realize, they're able to touch the pulse of the country, and by the time they're making the decision, compared to those ones of the counterparts who are men, and if you look at countries like the US, I think it's totally different when you what we have seen, and that also goes to tell us what we must do to ensure that we have more women in those positions at the highest level, including being Madam President. It also goes to reaffirm it's important to have women in those positions.
Okay. Yep. Now, Rachel Mwikali, you come from the informal settlements, and definitely, as we said earlier on, is that women are at the frontline workers, especially when it comes to giving care in society. How has this pandemic actually shone light on the leadership skills of women in the informal settlements?
Thank you so much, and thank you for having me on air. I think the most important thing that all of us should recognize during this time of COVID-19 is that more young women and more women human rights defenders have been in the forefront also to support community and to be able to respond in a way that community can be supported. Like, for example, where I come from, and the people we work with also as Coalition for Grassroots Human Rights Defenders, majority of us also, we are women, and looking in terms of now we have been able to work together even to provide community with access to sanitary towels, which also should be like a government responsibility, and information on the contraceptive, and also food, access to food, which is also a right. And not only in Mathare, but also we have people also like Edita in Kibra. You can see our leadership, and there she has been responding. We have people like Marianne in Kayole. So we have like a multiple of young women that have been responding and supporting community. But also like it comes back to what Wangeshi she's saying about who comes on the visibility part of it. And how does patriarchy and systematic structure that works against women are able to visualize and make even Kenya understand that young women are responding, and are responding effectively to support their community. Because if you can look even in the past 3 months since COVID started, there hasn't been a lot of visibility of young women that are responding and taking up leadership to support their community, and taking up even more role that even most MPs are not taking. Taking up more roles that even like people who are elected leaders that are not taking and not looking at it in an aspect that has to be in a feminist response perspective on this COVID time. And that's why like we'll see majority of us, including myself, we are pushing so hard even in our different platform, governments to look, especially our governments, to look the response of COVID-19 on a feminist or gender justice perspective. Like how does it affect women in terms of accessing sexual reproductive health rights, in terms of accessing also like, for example, we had a case in Mathare when there was a woman who was pregnant, but it was during curfew time. People wouldn't, because of security issue and because also there was no deployment of police women, so she ended up losing her life, which is very unfortunate. So if we had also like, if you ask me if the whole leadership even within our government was gender, like it was led by a woman, all this mechanism would have been able to look the needs of women in different ways. And now does it respond? And looking that also women were not homogeneous. So we should not be put in one, like one marking scheme, but being looked at how different groups of women are being affected and what kind of interventions can they be put in place to be able to support women and young girls.
Okay, I hear you, Mwikali. Let me bring in Charles Leshore. You are a project manager and your region includes the Ma community. How has this pandemic gone to affect the access to sexual and reproductive health for women?
Thank you. Thank you this morning. Good morning, everybody.
Good morning.
And yes, I want to talk on behalf of COVID-19 and how it has affected the governments and communities around the world. And most governments and communities are all struggling to respond to COVID-19. Already, for marginalized communities, these are communities that live in hard-to-reach areas. They are communities that do not have access to sexual reproductive health and services, including information to sexual information and also information around the COVID-19. When you look at women and girls in these communities, basically they have had devastating effects. The pandemic has had devastating effects on them, their livelihoods, for especially the girls in these communities. These are teenage girls and adolescent girls who have to access, for example, menstrual pads. They cannot be able to do that now because the schools have been closed. And the only source of them to access these for schools. Now the schools are closed, they cannot do that. When it comes to issues of harmful traditional practices, now they are the women and girls at risk because they face all these forms of gender-based violence. And we could say there are different forms facing this in terms of FGM and marriage, sexual abuse, verbal, emotional, psychological, and also economic, including also the effects of other unintended, for example, floods that came. Some communities are not even able now to access medicines. For example, in Maga, some parts have been already not been able to access services, and also the government is not able to access them because the swamps and the lakes prevent this. So we find, of course, these particular communities being marginalized, and even including also access to water is also a challenge. Assembly of Health Africa, access to water is very, very key. And this is one of the unmet needs. So when we look at unmet needs of these communities, again with the pandemic, then the effects and the consequences are quite alarming.
Okay, I hear you, Leshore, and we'll talk more about those effects on women and girls during this time. Let me bring in Alberta. Alberta, as Leshore has alluded to, the fact that there has been a spike in the number of gender-based violence victims during this pandemic. From where you sit, how does that look like? Alberta, can you hear me?
Clearly?
Okay. The question was, we have seen a spike of gender-based violence during this time of COVID-19. Sitting as an executive director at the GVRC, how does that look like in terms of numbers? Okay, it seems we are having a challenge with the network connection there with Alberta, but let me move on to Catherine Musakali, and I'll take you back to the question I put across to Wangeshi here in terms of the leadership skills that have come out to shine amongst the women in this pandemic. What does that mean to you, and how does that go to affirm women in leadership?
Thank you very much for having me this morning. I think one of the key skills that women have is humility. Women are not afraid to be humble. And because of that, they are able to actually shine during this time. They're not afraid of asking for help when they need to ask for help. Women focus a lot on building relationships. And because of that, this is the time where people need empathy, emotional intelligence skills. And I have seen that a lot of the women leaders actually demonstrate that. If you look across Africa, we have about 13 ministers of health leading the fight against COVID-19. And those women have done so well in their countries. And so for me, I think women have excelled because of the skills that they demonstrate. And I am not for one moment saying that the skills that men demonstrate are not important. But I'm just saying that the skills that women have really, really been used well during this COVID-19 period, because particularly because of the fact that women are not afraid to ask for help. Women demonstrate humility, perhaps much, much more than men do. And I think it is not because of our own doing. It's just because of the hormone that we have, oxytocin. Yeah.
Okay.
Basically, that is what is really, really helping us. And the men have a different hormone that pushes them to want to win, to want to show that they are the more important person. It's a hormone, it's a natural phenomenon that both men and women have. Thank you.
Okay, now Catherine, before you, maybe to just follow up on your trail of thought, it has been said women bring the soft issues to the table, and at times those soft issues are not what is needed. But are we saying at this time it has shown why those soft issues are critical?
Exactly, yeah. You know, for you to be successful, and I talk a lot about gender diversity on boards. If you have a board that is talking about soft skills throughout, then you miss out on the harder skills that you also need, yeah? So you need a balance of both the soft and the hard skills for you to make effective decisions for any company, yeah? And I think that is the reason why we are saying that women have really excelled, because this is the time that people are saying, oh my goodness, we need somebody to empathize. We need somebody to, you know, like connect with the other people. We need somebody who is not afraid of just letting go of ego and be able to bring to the table what we need to see on the table. And because of that, women have excelled. Thank you.
All right. Now, let's even look further into the leadership. Wangeshi, before we get deeper into the GVRC issue we are seeing, or rather GBV issue we are seeing, when you talk about leadership, there are so many balls to be balanced right now. Women are the key, or they hold the core of society, but now there's so many things that have moved. Women are working from home, everybody is back at home, and they are still expected to excel. What does that mean for the woman?
I think for the women, and this is not just about the women, I think what is calling for us is really to be able to look at what are our gender norms and how have we been able to frame the work that is done by women and the work that is done by men. A lot of people who are are working from home, and that also means that there's a lot of work that is expected of women, for example, taking care of the children who are at home, and therefore this calls at a time that is important to be able to redistribute the work at a family level. is it possible for both men and women to be able to support the children, so that also the women, as they're working from home, that work is shared. For a long time, what is called the unpaid care, nobody ever recognized this, and it's a lot of work. I think this pandemic, what it is doing is be able to show that for a long time this work was not recognized by anybody, and this is time to be able to recognize that work to be able to be redistributed. It cannot just be left to the hands of the women, because parenting is not for one individual, and therefore calling also for employers that as they are doing this, it's possible that people can be able to work from home, those who are able to, but also to be able to be supported, that they are taking care of the children, that they can also be able to be able to support the work that they do, and hence very, very important that we start re-examining how do we frame our gender norms. So a very, very great opportunity. And I think this pandemic, what is calling for that this is a time to be able to relook, to be able to reorganize, and also to be able to see how do we support each other. But also very, very important is the solidarity that is required.
Okay, now Mwikali, in the informal settlements, and I think this is across board, there has been a loss of income. Businesses have come to a close, and those small businesses mostly are run by these women. The loss of income, what kind of impact does it have on women?
I think also, like, as a country, we need to look on the level on now the COVID-19 has been able to affect the socioeconomic rights of women, and to a level whereby most of them now it's hard to be able to provide for their households and for their livelihoods and the kids. And this has led more to violence against women and girls in their households, which has forced now, like based the way I'd said before, that the mechanism was not looked on how to respond to support these women, so that most of the time now women and girls are forced to stay in the same house with the abusers. And now it goes back to also like how collectively as a society, despite yes we say the social distance, or when we say that let's work at home or stay at home, I think it's very problematic when our government was looking at this kind of intervention and not looking the kind of housing that most informal settlements we have. And then also in terms of also the sanitation process, like how sometimes you have to go outside to use the washroom, the level of security. So I think, if you ask me, in my perspective, it has catalyzed more violence than the way it was before, to upper hand that it exposes more women and girls at this moment. And their business now are closed, because like, for example, if now you're having a small business, how many people have the money to sort of buy things from your household? At the same time, for the women that used to do domestic work at Isli, when there was a lockdown, most of them lost their livelihoods. So I think even when the government was saying they were giving money or support through the phone, I'd be really happy to hear like how many have benefited, how many women in terms of gender or young women have been able to benefit from this kind of support the government was saying. Because so far I have a critique on that. Most women haven't benefited from that. And if you know also, like when it comes to power dynamic in a relationship, men would rather take advantage of economic impacts to also violate women and young women.
Okay, now, Leshore, even as we talk about economic empowerment being very critical in empowering the woman, and that being very related to the access to healthcare, how does this translate in the marginalized space?
Thank you, Gachanja. In the marginalized communities, there are also some significant issues when it comes to economic and cultural rights, and also sexual reproductive health. Number one is the fact that, of course, the mortality rate with the pandemic is more seen in men than women. But the current crisis, the pandemic, will really have significantly negative effects on health and the economy of women. Some of the women economically in these communities depend on markets, going to marketplaces and sell cows and be able to bring food home. Those markets have been closed. Their livelihoods have been affected. Most of the parents and husbands of these young wives have all left and come home. Means there have been quite job losses here. Some of them also depend on economically the tourism industry.
Yeah.
You know, in Masai Mara or Amboseli, where they sell beads to tourists, now there are no tourists. And of course, most of them who work on the lodges have also lost their economy. But when I look at, again, women and girls, they are the people who are responsible for home care. And of course, this infection and pandemic has really affected. There have been, of course, disruptions at this acute stage of the pandemic. And when you look at sexual reproductive health and services in terms of accessing, for example, HIV services, antenatal cares, you know, maternal health-related services, and sexual reproductive health services, these people now are not able to access because, one, some of the facilities are so far, and two, these are marginalized communities that have a lot of beliefs and myths around them. Now, they think the pandemic, the COVID-19, is a Nairobi disease, and mostly also relevant with healthcare providers. That particular fear of going to seek, and when you look at, again, issues of early pregnancies, we are afraid that this will be one of the effects of early pregnancies. There will be an increase. You know very well that Narok and Kajiado have been leading teenage pregnancy.
Yeah.
And the regional commissioner, Natembea, is one of my favorite heroes in this country because he always speaks to the minds of the people. So we are afraid that the complications, maternal health complications, will be on the increase. Mortality rate will also go up. Now, the discussions in issues of water, Umbrella Health Africa and other organizations make sure that there's access to water because it's one of the unmet needs. And it's the same women who go and fetch water, but they walk very long distances. Now, when they cannot be able to access these facilities because our technicians are not on the ground because of the pandemic and because of the restrictions, then women will really be affected. And again, the issue of menstrual. People will ask you, do you bring food or is that and the PPIs? Definitely what comes is the food. So there's a lot of disruptions when it comes to that. Of course, I know the schools. Yeah, I know the schools finally have been closed. We now know that it will take until September. It's quite a very long period, and the cases of gender-based violence, of course, will go up. These girls, of course, are also vulnerable, and the environment, because pandemic has made the environment back here in pastoral areas very conducive for this gender-based violence or harmful traditional practices. Just to say.
All right, and still on that topic, now that you brought it up, I think at this point, Wangeshu, we cannot ignore that the numbers have spiked. And the question is, how does the two relate? Well, Leshore has painted the picture that there is the lack of economic empowerment also related to the spike in GBV cases. What are factors feeding into this?
I think rightfully the cases of gender-based violence have increased, and just to give you, to also highlight what he has just highlighted, at an organization level, since 18th of March to date, we have received about 359 cases of gender-based violence. And this time, compared to the same time last year, this is a sharp increase with about 64%. If you look at the data that is coming from courts have said the cases that have been reported at about 35%. The Cabinet Secretary, Professor Kobia, also highlighted in an interview that we've had about 42%. And finally, we have the national hotline, which is 1195, that have also reported an increase to 75%. And we started asking ourselves what is causing all these kind of increase. Of course, the government of Kenya have put in measures to be able to deal with COVID-19. But those measures, we know, whereas they are good to be able to prevent COVID-19 from spreading, that they also have other implications, and especially when it comes to violence against women and girls. The closure for schools, schools provide a space where at least girls are protected from sexual violence. What have happened is that the vulnerability has gone very, very high. Economic stress, people don't have their livelihood. I think Rachel Mikali highlighted very, very well the mama fours. If you walk along Gong Road, a lot of people who had their economic livelihood working in other homes, they are no longer able to do that. And this has also implied that homes, which we already knew that is not the safest place for women, is that has also seen an increase in domestic violence. I think the other one is around that our institutions that are mandated to be able to respond to issues of COVID-19, specifically the police, who are all now being deployed to deal with curfews and all that. We've had in different parts of the country whereby women are saying when they go to report cases, they are being told, this time we are all responding to COVID-19, and therefore increasing the level of impunity, because, you know, even if this matter is reported, it's not likely to be taken up. The priority, even in courts, and our ODPP is not working as fast as it ought to be. The pathway to be able to support those cases and the referral mechanism are also not very, very strong, because some of those institutions are not working as, and rightfully, because, for example, the police have been deployed. But we think that it's possible to be able to prioritize. Ethiopia, that has a Chief Justice who is a lady, who is a female, she has provided leadership that during this time of COVID-19, that matters of domestic violence are going to be prioritized from the Office of ODPP, have also been prioritized in court. And it's possible to do this. Right now, if Wanjiku wanted to go to court, she'd be wondering, okay, where do I have data bundles to be able to present myself in court? Very, very difficult time. And therefore, even as our government continues to plan on COVID response, COVID recovery, COVID resilience, is important to ensure that the face of the women and the girls is at the heart of planning for that.
Okay.
Yeah.
And even as we continue to speak about the gains that have actually been eaten away by the current pandemic of COVID-19, women hold only 7% of the world's government leadership roles, as I had actually mentioned, and there are women that have shown in this pandemic, and they have stood out, and they are being celebrated in as far as how they have dealt with this pandemic. Dr. Mercy Mwangangi, CAS Health, is easily the most visible face in coronavirus briefings held outside Afya House. Today, everyone who watches daily press briefings on the COVID-19 pandemic in Kenya knows Mwangangi as a soft-spoken yet firm young doctor who, in the absence of Health Cabinet Secretary Mutahi Kagwe, steps in to give Kenyans and the world updates on the virus spread. And she's the CS's right-hand woman. Now, the two work side by side. Now, across the borders, Jacinda Ardern, she's the New Zealand Prime Minister, and on March 23rd, a month after the country recorded its first case, New Zealand committed to an elimination strategy. Now, a few days later, the Prime Minister announced a strict national lockdown with it only, and at this point, they only had 102 cases and 0 deaths. Her swift decision making won and winning international praise, including that from the WHO. Now, across the borders, German's Chancellor Angela Merkel, the 65-year-old politician, entered self-quarantine on March the 22nd, 2 days after a doctor who gave her a precautionary vaccine tested positive for the novel coronavirus. Now, Merkel lauded for using science to explain how the government had done the lockdown with her PhD in quantum chemistry, and she's certainly in a position to speak with authority. Through this COVID-19 season, she has been exemplary by painting a leadership of I lead, you follow. Now, across the borders, just here in our neighboring country, Uganda, Dr. Jane Ruth is saying the Ugandan health minister made headlines in Uganda when she went ahead to give a special message to the tourists at the airport, where she informed them that it is either they exited the country or stayed there and followed the stringent measure the country had put in place to make sure that they tamed COVID-19. She will always stand out as that Iron Lady who was very clear on how and what she needed to say and do in this time. Now, let me cross over to Catherine. Even as we talk about women in leadership, Catherine and the other speakers have alluded to the fact that there are some downsides to this pandemic that are pulling them down. Even as companies are relooking how to restructure their companies, isn't it not imperative to consider that there are some circumstances that favor one gender and not the other?
Sorry, you were not very clear. Please repeat that for me.
At this time where we are seeing the disruption of COVID-19, is it critical for companies to be aware that there are circumstances that favor one gender over the other?
Yes, I totally agree with you on that one. And probably that is what is also leading to an increase in gender-based violence. When you look at the burden that women bear at this time, women are caregivers. When you come home, if you're, for example, working from home and your son or daughter is going to school also from home, sometimes you have to sit with them. Women are also, most of the families actually across Kenya are headed by females. It's just that it's not admitted. And it's not something that is talked about a lot of the times. And so I think it is important that even as we think about letting people go, even as we think about salary cuts, so on and so forth, we've got to consider the special circumstances that women have. And some of those special circumstances actually are financial in nature. And sometimes when women go home and they haven't brought contributed to the financial budget, sometimes this leads to gender-based violence. And so I think it is very, very important that everybody looks at the impact of COVID-19 wearing gender lens. Even as we budget during COVID-19, it is important that we do gender-based budgeting because women are impacted in a totally different way than men are. And so it's important. Thank you.
Thank you, Catherine. And Muikali, even as we look at the circumstances in the informal settlements, we talked about the direct relation between economic empowerment and the access to health. How does that look like right now in the informal settlements?
I think that we have to be clear in terms, like for example, in Mathare constituency, we only have, is it one public hospital, that is Lions, that is responding. And then you can see to a level if you have a case of violence against women at night, where will you take the women to the hospital? So you can see it's also like violating the way I'd said before, making it not accessible for women to access the hospital even at night. It becomes also problematic. And then like looking in terms of like when the first, I think there was at this public hospital, was it in Ngara, during the COVID when they said there was also like a suspect of corona case in that hospital. Yeah. It made even this hospital in Mathare be closed. So you can imagine if you only have one public hospital and the estimate of having 500,000 people living in that community, how does it affect women when you're having cases of violence against women? And whereby before you go to police, you have to go to the hospital to come with a medical report and come and to report the police to be supported. But also coming to what Wangeshi had said, and this is also my problematic with the cases that I've taken to the police station, is that when you bring the case, and this is why I think the president also and the minister for health, they need to be clear when they're giving their press briefing and putting it very clear that violence against women and girls should be part of their communication strategy. Because if you're not putting it as part of communication strategy as also like worse than even COVID itself, it's catalyzed violence. Because if you're having a case of a man that has assaulted a woman or a child has been defiled, which as a movement, we're also having that case of a child defiled who was 12 years old. They're like, we can't, the government is very clear. We can't put people on cell, courts are not working, and then you can wonder, like even if COVID is there, violence against women is not, still it continues. So the government should take it serious, because also you saw the Chief Justice Maraga when he said that in the courts they are getting a lot of violence against women. Yeah. So you can imagine if a man violates a woman and they are not arrested, it's catalyzed. It makes the case continue, men continue taking advantage of women, taking advantage of even girls. So our government needs to put very tough measures and work with civil society organizations and social movements and women human rights defenders that are responding in support of ensuring that the rights of girls and women are supported, and ensuring like rights to access to health. It's put in primary consideration and it's put on the table and it's put like in terms of implementation as a first priority in responding to COVID, and not only looking, let's stop spreading, but looking on how it affects women. Because if you can look, for example, on the case of Sierra Leone, when the Ebola, the outbreak of Ebola, there was high cases of increase of girls' early pregnancy, which for me it's my worry, like after COVID, how many girls will be impregnated, like early pregnancy cases, if you're not taking this seriously, and how many unsafe abortion that will have in both. Yeah. So like we need to be very clear, like how are we ensuring that we have access to contraceptive, access to good medical facility for the women, and protection of these women when they come to the hospital, and how youth-friendly are these facilities to young women and to girls when we go there? Are they listening to us, or are they looking as if they're using a traditional moral of politics of victimizing the young women who come to seek for services?
Okay, very well said. Now over to Leshore. Mwikali has talked about the importance of actually looking out for those victims of sexual gender-based violence. Now we know the importance of safe houses. We know the importance of those shelters that these girls and women have been running to. They have been closed. What is the alternative right now?
Gachanja, one of the facts is that 1 to 3 women globally experience some form of physical or sexual violence or abuse in their lives. We are 90 days after the first case of the COVID, and I know the first case actually happened also to be in Kajiado. But again, when it comes to safe houses, one of the safest houses that we could say safe houses is schools for pastoralist communities that really also have inadequate infrastructure in terms of boarding schools and hostels for girls. Now the schools have been closed. It's in the same schools that they get, for example, they can access sanitary pads. It is also in the same schools that they can access information on sexual reproductive health, life skills, you know, and also the school is a safe space in terms of keeping them there and to avoid FGM and early child marriages. What's happening now is that the girls are at home, beside the efforts put down by the organizations and partners in terms of champions protecting the girls, training, for example, the chiefs, and more other interventions to ensure that the girls are safe. I think at the moment they are at risk. And they are at risk because some of the areas that these girls are hard to reach areas. So in terms of reaching them, in terms of the internet, in terms of accessing airtime is a challenge. Our own children officers, of course, are alert. But again, in terms of the restrictions, I mean, people cannot be moving from one place to another to go and report. So reporting becomes also a challenge. So what is happening now is, of course, we are really working out with the chiefs, especially under the presidential directive, to protect and ensure that there is zero cuts. I mean, there are less girls cuts, and what we want to maintain is to ensure that it is completely zero. And the ministry, and this is also aligned and anchored in the Kenya's ICPD 25 Nairobi Summit, when, of course, most countries, of course, committed to protecting this particular girls. They save some of the homes, most of the homes that these girls could run home. These are normally the rescue homes. Most of them have been closed because, again, they depend on partners, they depend on donors, they depend on individuals to give in kind. Now they start restriction in terms of movement from one county to another, and therefore this has really restricted people who have been supporting girls in these particular homes. So it is now a big challenge, of course, for the Children's Office and the government also to ensure that these girls are sustained in these particular homes. We normally hold virtual meetings with our partners who report, and they see us also on the ground. They report to us on a daily basis, on a weekly basis, what is happening, you know. And there have been a lot of cases of rescues. There's also a lot of girls who are running away from marriages, particularly in some of the hotspots villages in our 4 sub-counties that we target in our interventions. So it's not very safe for the girls now. And because we are in the active stage, we can only know the impact of this maybe when the schools will be open, because we expect a sort of a register to find out how many girls have come back to schools, how many are missing, where are they? And I think I really want to follow up on one of the campaigns by Natembeya, where he actually asked the chief and alerted them on this. Of course, FGM is also now a trend. It's a new trend of doing it secretly and doing it cross-border. From some of our researches that have been done, for example, for Kajiado County, we were able to move away from the KDHS data and did also another survey really to determine the prevalence at sub-counties level. And we were really able to realize that, of course, FGM is still high. And for example, when you look at Kajiado West of Kajiado County, when we did this study, which was to determine the factors that could really accelerate FGM cases, at sub-county level, it was at 97.9%. And at the county, the entire county is about 91.5%. But of course, KDH puts Maasai in general at 78%.
Wow.
East is at 84%, and Kajiado South, which is Loitoktok, is at about 88%. So we find the South and East being promising in terms of ending FGM, especially East. East is leading because, again, of course, you know, there is a lot of influence on education, and that also made it possible to have the first Maasai woman in parliament.
Yes.
So this is again why we're looking at gender and education.
Leshore, we hear you, and definitely due to increased cases of sexual and gender-based violence during this time of COVID-19 pandemic, the Directorate of Community Policing has obtained a toll-free line that is 0800 730 999. Let me read that again, 0800 730 999, to be used by members of the public to report any cases of sexual gender-based violence. Something that you should always be keen on and always look out so that we can be our brothers' keepers. Now, I will bring in Catherine. Catherine, even on a corporate level, as we think about the interventions to make in as far as walking and supporting those that are facing gender-based violence at home that work in these spaces, I think we need to talk about how the solutions or how the structure, the support system needs to look like at the workplace and beyond that. And we'll do that right after this break. Thank you for staying with Your World. My name is Gladys Gachanja, and we're still having that conversation, trying to take stock on how COVID-19 has actually disrupted and eaten on the gains that have been made in achieving gender parity. Now, when most people hear gender parity, they think we're here to talk about women. No, gender parity actually talked about the equal rights for both boys and girls, but we also have to be cognizant that there are circumstances that make women and girls more vulnerable, and that's why we are actually focusing on some of those that have reared an ugly head and are pulling back on the gains that have been put in place to empower them. Now, to have this conversation, Wangeshi Wachira, Executive Director, Center for Rights, Education and Awareness, Rachel Mwikali, women rights activist, and she lives in Mathare, brings a perspective from the informal settlements, Catherine Musakali, who is a co-founder of the Women on Boards, Charles Leshore, who is a project manager with Amref Health Africa, and Alberta Wambua, who is Executive Director, Gender Violence Recovery Center, even as we take stock of this conversation. Now, Catherine, as we were going to the break, we needed to get now to the solutions that we need to see going forward. When we talk about gender-based violence, these are people that work in organizations. These are people that run businesses. What should be put in place to give sort of a support system, both at home and at the workplace?
Thank you, Gladys. Let me try and speak about including the rural women as well.
Yes.
And there are simple solutions that can be put in place. First and foremost, at the village level, it is very easy to put in place, or even at the county level, it's very easy to put in place specialist people just to deal with gender matters. And make sure that the women within the village know that if they have an issue, they have a to-go-to person. Mm-hmm. Yeah. Secondly, it is awareness, ensuring that people are aware that gender violence is a no-no. Starting to empower both girls and boys. You know, you might talk about empowering girls and forgetting about the boys. Mm-hmm. But the boys are the ones that need to know that lifting your hand against a woman is a no-no. Yeah? So starting to ensure that the population, right from a very early age, are aware that gender violence is a no-no. Coming back to the corporate world and the business world, I think we need to make sure that we have an overarching policy against gender-based violence, and we need to make sure that each organization and each business has adopted gender-friendly policies that completely outlaw gender-based violence, yeah? And ensuring that these policies are actually auditable. The implementation of these policies are actually auditable. Ensuring that the women themselves are very aware about their rights. And they know that if their rights are in any way violated by anybody, that they know where to go and where to report. The toll-free number is good to have, but right in the village, if I have no phone, that toll-free number is useless to me. Mm-hmm. And therefore, ensuring that even at the chief's level, even at the village elders level, there is somebody advising this chief or this elder on gender-based, on gender matters. And when you go back to the village, this may not even cost anything. There are very many ladies in the village who are willing to put themselves forward to be able to actually deal with these questions. It's just a question of telling them that they are responsible for this issue, and if anybody is suffering, they should come to them. If you go to the informal sectors, the work that is being done there by my fellow panelists this morning is wonderful. But ensuring that each girl is aware of their rights, that each girl has a place to go to. Now, the issue of going to report cases and nothing is taken up, nothing is done about it, is holding back people from reporting. So ensuring that once a matter is reported, that it is handled to its logical conclusion. Mm-hmm. And making sure that we are using people who have violated girls and women as examples for the rest. There is no point in me going to a police station and I meet somebody who is asking me questions that are very intrusive to my own person. And what that means is that if I experience a similar circumstance in the future, I am not going to go there. So we've got to make sure that even the people who are handling these issues are sensitive to the needs and the privacy needs of women, and that they are able to follow up these matters to their logical conclusion. We have a number of hospitals all over the country. I think right now, this is the time to make sure that there is, even if it's just a small room with one person seated there dealing with gender-based issues, and that this person has the capacity and the capability to actually handle this matter. So it is about time that as a country, we started talking about gender specialists and making sure that these gender specialists are in touch with all the issues relating to gender-based violence going on in the country. Thank you.
Very well said. And Mwikali, let me bring you into this conversation. In the informal settlements, when you think about the circumstances that are working against the woman or her empowerment at this point, what would be the ideal situation to ensure that she still is protected?
Thank you, Gladys. I think one, the way I'd said before, is that ensuring, like, if we report the case at the police station, is taken with a lot of seriousness and not being asked all these questions. Like the way I'd said, a case we have a 12-year-old child that was defiled, like asking someone that was defiled, where is your witness? You can imagine at that level. Is it pushing us forward or is it taking us behind? And then looking in terms of mental health, and in terms of what triggers, is that we stop also putting women and girls in the same place with their violators, and taking the right of a violator to be more important than the survivor. I think if now we start having that conversation as a country and as a society, whereby also men in the society acknowledge that the fact they exist as men, they have privilege and they have power, that they need also to use that power they have to call out men that are abusive, that are also oppressing girls, that are also like actualizing the violence into women's body. And calling back to this also, you can see to the level that we have been having also of cases of femicide, killing of women, violating young women's body. Like when we bring this conversation even to the national media conversation, what narrative do you usually bring? Because if you bring a narrative of law versus morality, that's where we lose it. Because morality, what is moral to you is not moral to me. But the law is very paramount. And that's also like, when it comes to local, and I'm happy like the guy from AMREF and Catherine said, is that also I feel that also the government should put it in clear, and society and different stakeholders, the role of local administration, and to be clear, chief, and there are people in the ground, village elders, is not to deal with the criminal case in kangaroo's court. It's to deal with civil wrong and not criminal case whereby it's violence against women and girls. Because that's why I feel, and with my experience and the team we work with and different women human rights defenders have been in the forefront, they also like the ones who also make our work become harder. When they bring these cases in a table, like let's negotiate, whoever has money, definitely is a man, wins the case, it becomes really bad.
Okay.
It becomes really bad in a manner like it triggers a lot of psychological violence, and the psychological violence is also very violating to our mind, to our body, to our thoughts, and it becomes also a violation. So we need to stop also looking not only physical violence, but also psychological violence.
Okay, now, Leshori, even as we look at the solutions, at this point, the sources of income are not there, the women are not economically empowered. You said they are the ones who run the home in terms of what does the family eat in this first place? In the marginalized areas, what should be the ideal? How should the government actually support them?
I want to look at that in terms of long-term and short-term as a result of the impact of the pandemic.
Yes.
Luckily enough, we had rains from last year, and therefore for these pastoralist communities, they actually had sufficient grass. They had actually some water for their cows, and therefore the situation is not badly off. What they cannot access, of course, is of course vegetables that women, like pregnant women, will need for their nutrients. Girls in their adolescence and teenage need extra nutrients. They need ions and all that. And I think that particular access should be very critical. But let me just very quickly look at the long term and short term, what we should do. Of course, the government is playing its role. It has responded to COVID-19 very well. But again, I think it is also of a challenge in terms of short term and long term. And number one is human rights. So let us ensure that human rights is upheld now, during, and even the post-COVID and this time of crisis. Number two is for the government and all humanitarian sector to consider the needs of girls and women. When you look at, for example, the sanitary pads, it's not a choice, you know. It's biological, it's a right, it's God-made. So in some of these communities, like the pastoralist communities, it's about taboo to discuss about these things.
Yes.
And I think through Radio Nosim, Radio Mayan, and the Bas Radio in Kajiado, our champions have been there talking about these gender-related issues. Another very important thing to consider is adolescents girls programming and safe spaces. So let the government also look at how to help the rescue centers and all the safe spaces that are now closed, that other partners cannot access, so that there is some sort of approval for them to go and access and drop foods. We want to thank, of course, Bas Radio. They have been fundraising and getting food from populations to drop to these homes. They should also consider social, cultural, and gender norms to influence vulnerability to infections. For example, the Maasai in pastoralist communities, there is a way the girls will greet their fathers, you know, by bowing down their heads. Now with the COVID-19, you know, these social-cultural norms should influence infections and treatment, so that, again, the social norms do not increase transmission of the pandemic. Another one is very important, is that women and girls should be consulted. So we should have interviews. Let us call the girls, virtual meetings. How are you doing? What are the risks that you are facing? There should be a way to consult them, and data is very critical. A number of organizations, including Amref Health Africa, population councils, are developing and are running a number of researches that inform public health and behavior change.
Thank you, Leshore. Thank you, Leshore.
And finally,
yes.
The government should allocate funds for sexual reproductive health and access to comprehensive sexuality education. Thank you.
Definitely, definitely. So now, Wangeshi, there is somebody here who's saying, I am disappointed that all I hear is you talking about how the girl has been affected. And the truth of the matter is the boy child has also been affected. When we talk about the loss of income, it's that it has hit hard. That young man that does not have a source of income anymore. How does that look like in as far as ensuring that they stay empowered economically?
I think for me, COVID-19, what it has done is provide the perfect storm to be able to accelerate issues of gender equality. And when I talk about gender equality, I see strategic opportunity, for example, for government to ensure that we have safety nets, and safety nets that are able to look at both men and women, but also look at the most vulnerable groups. And when we talk about vulnerable groups, for me here is that we have seen women, we have seen a lot of young people who don't have employment. We have the cash transfer program with the national government, but this only targets a very, very age group of 70 and above. And from my conversation and what I have seen is that this list, the last time was updated, I think it was 2016. So is that then the opportunity to be able to see what do we do with all the young people who have not been able to access employment? In other countries, what have happened is that you've seen government put measures that if, for example, you don't have, if you had a job and you have lost your job, you at least get 70% 70% income. If you had a business and that business is not making any profit this time, again you are cushioned and you're given a percentage to be able to be able to survive, because this is a time for survival, and therefore we Kenyans are paying tax, and therefore this is the time then for our government to be able to show up and be able to provide that safety net that is really direly needed by almost all population, and more so to be able to target the very, very, very vulnerable. In terms of whether it's both men and women being affected by gender-based violence, we recognize there are men who are also violated. And I think Alberta, who is in this call, she can be able, is a witness that the GVRC, for example, has received cases of men who've been violated. But when we look at the magnitude, we have more women who have been affected, they are young girls who've been affected, again providing another opportunity that, for example, why don't we have shelters in this country that are funded by government of Kenya? Makueni County, I think, has just put one shelter to be able to respond to issues of GBV during this time. I think is a good move, but we would want to see the state to be able to support, because those are the things. When a woman calls at night saying that I am looking for a place to be able to even to get shelter, it is not there, and therefore providing that opportunity. CRU has just partnered with EU. We're also partnering with Oxfam to be able to do cash transfer, and the cash transfer that we are going to do is going to target people in Nairobi, 80,000 of them. Some of them were already in the Inua Jamii program. But for us in Wangu Kanja Foundation, why we're in this consortium is to be able to target women who have been violated. Cash transfer have been evaluated as a model that works to prevent domestic violence. So again, we'll be able to distribute that resources for a period of 3 to 6 months so that we can cushion families that currently are going through very, very stressful time when it comes to issues of financial within their family. So I think this is an opportunity that cash transfer, if there are corruption, can it be exposed? If there are vulnerable groups that need to access these resources, this is the time for the country to show up for its people. And it has happened in other parts of the world, and therefore provides a very, very good opportunity that all those things that a lot of young people, women, both men and women, are experiencing, that can be considered.
So as we continue to have that conversation on how COVID-19, this pandemic has disrupted and eaten into the gains of gender parity, this short animated video explains gender equity in contexts of forests and climate change initiatives. It illustrates the key aspects of gender equity, fairness. A gender equitable approach means that men and women are treated fairly, they have equal rights and representation, both participate in decision making and receive a fair share of benefits and costs.
Gender equity means men and women are treated fairly. They have equal rights and representation, both participate in decision-making, and receive a fair share of benefits. Failing to consider the varying capacities and vulnerabilities of women and men puts communities and their forests at risk for conflict, food insecurity, and poverty. First, we must consider how the benefits, costs, and risks are distributed amongst local women and men. Second, procedures must be in place to help bring both their perspectives to the table. And finally, we must understand the community's social and political dynamics and how it influences their decisions, or the kinds of benefits or costs they will take up. For the communities in the Lower Mekong, this means women need to be part of the decisions that determine how forests are managed from the very beginning.
Well done, NDS, emphasizing that this conversation is for both men and women. Catherine, you're about to leave us, but before you do, I'd like us to talk about best practices at this point, even with the disruption coming, to give us or shed light on some of the gaps we have left in as far as achieving equality for both genders in the workplace and any other areas of society. What would be your parting shot?
Thank you, Gladys. First and foremost, allow me to say that information is power. And so we need to make sure that women have the information they need to be able to defend themselves, have the information they need to know that I mean, they should not just accept being battered, being harassed, so on and so forth. I went to Sierra Leone, and what I found is that there were posters all over the street about gender-based violence. In offices, when you walked into offices, there were posters against gender-based violence, so on and so forth. And so I think one of the things that we must do is widely share this information that gender-based violence is wrong. The truth of the matter is that gender-based violence affects both men and women. And the men have to know that it is wrong, the women have to know it is wrong. When it happens in a family, it impacts the girls the same way it impacts the boys. And so we must make sure that even at family level, the family is indeed aware that gender-based violence is wrong. And so for me, information and information for both men and women. In terms of some of the best practices that we can use, particularly at corporate level, it is just ensuring that we embed those gender-friendly policies, and also ensuring that even as we embed them, that people know what to do should something go wrong. That, in my view, would really go a long way in terms of stemming gender-based violence, and also ensuring that the women are economically empowered to be able to stand up on their own, to be able, so that they don't stay in abusive relationships. Because sometimes people stay in abusive relationships because of financial support. So we do need to make sure that they are able to stand up on their own, that we have within the country good policies that support gender parity, gender equality, and that gender-based violence is completely known by everybody that it is wrong. Thank you.
Thank you for joining us. Catherine Musakali, who is a co-founder of the Women on Boards. Thank you. Have yourself a wonderful day. And of course, we wish you good health and safety. And at this point, we take a short break on Your World. When we do return, Alberta Wambua will finally be joining us, and she will be breaking down for us the numbers and how this is affecting both genders. And I'm talking about the male and the females. Stay with us. Back home, and to be precise, in studio, we are now joined by Alberta Wambua, who is the Executive Director of the Gender Recovery Center here in Nairobi. And Alberta, it has been said that gender-based violence has not only affected women, it has also affected men. How does that look like in terms of numbers?
Thank you, Gladys. So as you rightfully say, we've had a spike in the increase in cases of gender-based violence. This has risen by 45%. And this is the cases that we receive within our 9 centers at the Nairobi Women's Hospital. So I totally agree. Men have also been affected. Men and boys have also been affected. And actually in most of the forms of violence, the same as the women. So we have men who've been physically violated. Last week, we just saw 2 men who had been violated physically. One, the arm was broken, one, the arm was cut by their spouses. But of course, it was compounded. There was economic also violence. There's emotional violence. So yes, we are receiving cases of both men and boys having been violated. A number of the cases that we are seeing, it's also changing the form and the presentation of the cases. For example, so last month in one of our hospitals, all the girls who came in, who are about teenage girls who came in for a certain week, were all pregnant. These were about 8 girls. So it's also bringing on board a lot of late presentations because of issues maybe you must have likely discussed earlier. We have the cessations, we have challenges in terms of access to services. So we're also having late presentations, and we expect that a lot. And sadly, then that means then we have, manifestations of the violence. So most likely we'll have more people infected with HIV, AIDS, girls who are getting pregnant, and so on. Thank you.
And Iti, you run a recovery center. Now, with all the parameters that have been put in place to deter COVID-19 infections, is it business as usual at your center?
It's not business as usual at my center and many other GBV centers across So one of the things is that in the earlier months, that's about March and March specifically, and maybe a bit of April, we had less clients coming to the hospital because then they were fearing, as much as the cases had risen, survivors were fearing to go to hospitals in the fear of contracting COVID-19 there, the coronavirus there. We've also had a number of cases, not just at the GVRC centers, but across. We've also had cases, I'm talking about at a national level, where frontline workers were also scared to provide treatment because then there was either lack of PPEs or not knowing how to use the PPEs. So that was also a challenge. Again, now, this is even very different because just this week when we were discussing provision of shelters together with Wangeshi and one of our partners, that's the UN Women, and we're talking about how, for example, survivors need to be tested. So they need to be tested for COVID-19 before the treatment. If we are to admit GBV survivors at the center, for example, and we're having a number of survivors we need to admit, we have to provide the test again. The cheapest, I understand, is about 7,500. The government one, I'm not sure whether it's still available. So then when you have provision of funds, for example, ourselves, just for medical treatment and psychosocial support. But now you have to do pre-test for COVID-19. You have to make sure that you have PPEs. You have to make sure that you continuously train the frontline workers on safety, and the use of PPEs. You have to continuously, more than ever, provide mental wellness for the staff because it's not easy. Or, for example, you're having teenage girls who are now pregnant, so you have to provide prenatal care, the delivery, and the postnatal care. So it becomes really complex. Exactly. And even the late presentation, now you're dealing with fistulas, you're dealing with the aftermath of not providing prophylactic treatment. So that makes it really complex for us.
And Alberta, when you're dealing with male and female, the circumstances are different. When it comes to the males, how do you handle them when they come to your center?
So the difference is mostly in terms of maybe the treatments and also who provides the service. So one thing that males are is the very few of them would report unless there's severe physical violence. So what we also do is we provide also the toll-free numbers, again, with a lot of other partners with support from the Canadian High Commission, the Urgent Action Fund, the NIDA, and many of these partners. We are different organizations that are providing online counseling. So that's also provided, but it's also a way of doing the rescues, but also the reporting, because a lot of them would not want it, quote unquote, openly. But when they come to the centers, we then also provide frontline workers of the same gender, because then some of them would prefer the males. So we have male doctors, we have male clinicians, male nurses, male psychologists, male social workers providing that support. So that's there. The challenge then has been that you also need to have gender-specific services, quote unquote, so that then, for example, a lot of the shelters, when those who would need, for example, safe spaces, a lot of the shelters are for women and girls, and very few, almost none, we have for men. Yeah, exactly. So these are some of the conversations that we're having. How then do we make sure that we have services that are very gender-specific, age-specific, that have inclusion of all the 5 diversities, and just making sure that we have tailor-made services. And the way to do this is also to have the users participating in it. So we're having conversations with the public, of course, focused conversations. We are having conversations with the survivors. How would you like these services, for example, offered to you?
And when you think about the pandemic we're in, urban, rural, those numbers, do they look different or are they the same?
They're very different, and so is the severity of the cases. And unfortunately, again, most of these services are within the urban centers, the GBV response services, or, the level or the quality of services, even in the health, are within the urban centers. Now, with the cessations and lockdowns, you find that it's also hard for survivors, for example, to get services, and not just GBV services, but also health services or SRH services and commodities. We've had survivors, for example, who are not able to get their HIV medication because then, where they were going for service was across the county that's locked and all that. So it's very different. What we've also noticed in the rural areas is that the severity and the cases are also really bad, because then there's nowhere to report to, or rather it's within a community setting. And like at the urban area where my neighbor really doesn't know me and they can easily just go to a health facility nearby and get treatment. Because of the stigma discrimination, we are a bit hold back. But within the villages, within the urban center, it's easy to seek for that services. Within the rural center, one, the availability of the service, but also the discrimination and the stigma around it. So that's really hard. So unless you have, for example, in the rural area, I'll give an example of Kisii last week, where you have then, a community leader standing up and following up on a particular case and following up on the same. This was a girl who had been defiled by 4 men. I think we saw that, and she was really, really injured. So unless you have someone who is really on authority to be able to follow that up, unfortunately, that's not, the service support is not coming in as much.
Thank you, Alberta. Let me cross over to our friends in Uganda, and Walter Mwesije, my colleague from NTV Uganda, now joins us. Walter, even as you hear how the perspective looks like in Kenya when it comes to GBV, how does that look like in Uganda?
Well, thank you, Gladys, and a very good morning from here in Uganda. I would like to let you know that the picture is not any different. Between March 30th and April 28th here in Uganda, the Ministry of Gender and the police, announced that they had actually received more than 3,000 cases. They had recorded more than 3,000 cases of gender-based violence. And this, of course, also trickles down to, the ripple effects of GBV, trickle down to the little ones in the family, the children. More than 280 cases of the 3,000 were now violence against children. And of course, we've seen many cases where even, girls as young as 13 are impregnated. We, followed up a story where a 13-year-old, was impregnated and then, she gave birth about a week ago. Okay. And cases like that are many. The picture is not so much, affecting the men. The men actually, beating up their wives. We have stories where recently a man cut the wife, over a simple argument about food. We had another one who, poured very hot milk to the wife after, the man complained the wife did not give him bathing water. She didn't iron his clothes. Simple arguments like that. And of course, the police says these effects come up, and the church has been, passing the same message because we are not used to living together for a very, very long time.
Yes.
And that is why I think people are finding it very hard, and, many families are actually, having problems. But
Walter,
just like I had the...
Walter, a question to you. We've talked about the fact that we don't have enough shelters here in Kenya pre-COVID, and this is something that now has been shed, light has been shed on, that we need shelters for those that are violated. What's the situation in Uganda?
Similar situation. We don't have enough shelters, and actually most of the shelters here are provided by non-government organizations. The police has just a few, and, the government really needs to, I would say, put much emphasis in this, because the police itself doesn't have, spaces for these cases to be reported across the country. Not many people will come out, or not many police posts have police officers with expertise in handling cases of GBV. And this also becomes a problem, that when we have the effects of the lockdown and people can't move, and then you can't even report the case. Initially you'd probably just reach the police and just speak to anybody. But now we're in a lockdown, there's no contact that you can call. It really becomes very difficult. So even the 3,000 they are telling us, we could be having probably double that, or half of that number that has not reported.
Now, Walter, before I let you go, earlier on we mentioned the Ugandan health minister, that is Ruth Aceng, being one of the leaders that is being congratulated, lauded for how she has taken up her leadership skills in chartering that country, Uganda, through this crisis. What does that mean for the country in as far as women in leadership? I think we lost Walter Mwesige. He is my counterpart in NTV Uganda, but he gave us really good insights in as far as what the situation is in Uganda. And even as we wrap up this conversation, Wangeshi, I'd like us to look at some of the things that have been challenged by this pandemic in as far as the 8 to 5, working from home. 8 to 5 has been challenged. Working from home is the new norm. Hence, it is possible to actually have a work-life balance. Do you think going forward, these are things that should be considered even as we try to see how best to achieve gender parity?
I think the COVID-19 has really, with these challenges, has also provided opportunities, for example, on how we work. Rightfully, as you said, working from 8 to 5 in an office, working from home. I think moving forward will be very, very important for organizations and corporate to be able to look at how do we support staff members to continue working from home, as long as people can be able to deliver their what is expected of them. I think is a good opportunity. But this is only people who are working in the formal. I think it would also be good to see if we are not able to work, if the people who are not working in the formal sector, how do you also support them moving forward? If you're working in the formal sector, 8 to 5 is not going to be the usual. I think using virtual spaces is also providing a very, very good opportunity where people can be able to meet, can be able to put plans on things that they want to do. And therefore also then how do we create that, and how do corporates then or organizations then create that environment to ensure that people can still be able to contribute, but also balance between family, because most of the time you expect people to be in the office. Are they contributing? Is it possible for them to be able to be at home but also be able to support the family? Is it possible to redistribute what we call the unpaid care so that both men and women can be able to support the family? Is also an opportunity to even also to have a society is well in terms of in their well-being. So this COVID is also providing that opportunity. I think we should be able to, moving forward, how do we accelerate, how do we invest, how do we also action to ensure that people can be able to have a work-life balance. And for me, also moving forward in terms of ensuring that we support even the work around violence against women. I also see that COVID-19 is also providing that opportunity to ensure that we accelerate investment, we accelerate the actions. So if we don't have shelters, it is about time. Makueni, for example, as a county, has been able to put that. Can that be taken up by the other 46 counties to ensure we have such investment? Social or safety nets, is this an opportunity to be able to do that? But also, how do we talk about resolving conflict in a way that is non-violent? I think this conflict will always happen as long as people are able to interact and all that, but also provides an opportunity that it's possible to resolve issues without being very without violence in it. But I also see an opportunity for strategic partnership for government, for civil society organizations to be able to complement the work that we're happening. And I mentioned that we've just started a program where we'll be doing cash transfer for women who are survivors of violence in this country. And we hope to document so that then we can be able to share with the government of Kenya that it is possible to reduce violence against women during, and it has been documented as a model that reduces domestic violence, because we know people have lost their jobs. Yes. Companies have reduced salaries. People have asked to go home and there is no payment. People have been asked to go home and there is no food on the table. So cash transfer, even for the young people who have no jobs, is it about time that we looked at how do our contribution to our tax then is cushioning the citizen? Their stimulant project, is it possible to to ring fence within that and ensure that the packages that are being put are able to look at both needs of women and men. So this COVID, as it comes with challenges, is also providing an opportunity to be able to do things differently.
Very well said. Now, did you know women in rural parts of Africa spend 40 billion hours a year collecting water? Yes, Leshore actually alluded to the same, and according to a top survey done by the UN in rural parts of sub-Saharan Africa, a lack of services and infrastructure combined with an expectation of household duties and limited employment opportunities for women means they shoulder an unequal burden of gathering water and wood for their families. Now, did you also know that 33,000 girls become child brides every day? Well, globally, 12 million girls each year get married before the age of 18, roughly 33,000 every day, or 1 every 2 seconds. Now, there are some 650 million women alive today who were child brides, and the reasons behind it vary between communities, but it's often because girls are not valued as highly as boys, and marrying them off at a young age transfers the economic burden to another family. Lastly, did you know that even in the theater world, gender equity is not a thing? Well, for every female film character, there are 2.24 men. Now, the Gina Davis Institute analyzed 120 theatrical releases in 10 countries, where he found that of the 5,799 speaking or named characters, less than a third, that is 30.9%, were actually female, and more than a third, 69.1%, were male. Sounds out of this world, but these are the realities, and that's why it was crucial to have this conversation even as we take stock of gender parity. And before I bid you farewell, let us look at some of the feedback you've been giving us, even as we were asking you how has COVID-19 actually affected gender equality and the health and rights of girls and women. Patrick says, I think you live in a different Kenya. Boy child is nowadays being mistreated more than girl child. Ground is different, madam. Well, Wangeshi has been very clear. This is actually something that's affecting both boys and girls. Oliver Wekesa, you are empowering women while destroying the boy child. He's now an endangered species. Again, we have thwarted that claim. We are here to speak for both the genders. It's just that one is more vulnerable than the other. Honorable Jeff Mohammed says, what do you mean when you say gender-based violence? Men are also affected to a large extent. Again, this whole conversation has been very inclusive of both genders. Who speaks for men facing devastating effects of COVID-19 in marginalized communities? Fanuel Kasuni, these are conversations that are coming up, and I think Leshore touched on the fact that these are also matters that are being looked at. And we have another one here from Izidi, who says women cannot talk about issues affecting men. They do not live in men's world. The truth of the matter is they actually can, and those have been touched on during this conversation. Well, it has been a very incisive conversation. I've been joined by Wangeshi Washira, Executive Director, Center for Rights, Education and Awareness, Rachel Mukali, who is a women's rights activist in the informal setting, Charles Leshore, who is a project manager with AMREF Health Africa, Alberta Wambua, Executive Director, Gender Violence Recovery Center, and earlier on we had been joined by Catherine Musakali, who is a co-founder Women on Boards, and of course my colleague Walter Mwesije from NTV Uganda. Thank you for joining us on Your World. Tomorrow we take focus on the Day of the African Child. Join us then.